Trypanosomiasis, also known as African sleeping sickness, is a serious public health concern. This disease has been a significant issue for many years, affecting thousands of people annually. Despite efforts to control it, trypanosomiasis continues to pose a threat to the health and well-being of communities in affected regions. This parasitic disease primarily affects people living in sub-Saharan Africa, where the tsetse fly, the vector for the disease, is commonly found. The impact on these communities is profound, disrupting daily life and causing significant health challenges. Trypanosomiasis is caused by a parasite called Trypanosoma brucei. This microscopic organism invades the human body, leading to severe symptoms and complications if not treated promptly. The parasite is transmitted to humans through the bite of an infected tsetse fly. These flies are notorious for their painful bites and their role in spreading the disease. Tsetse flies are found only in rural parts of Africa, particularly in areas with dense vegetation and proximity to water sources. This makes rural communities especially vulnerable to the disease. Trypanosomiasis is a debilitating and potentially fatal disease if left untreated. Symptoms can include fever, headaches, joint pains, and itching. As the disease progresses, it can cause neurological and psychiatric disorders, leading to severe disability and death. There are two main types of trypanosomiasis: Trypanosoma brucei gambiense and Trypanosoma brucei rhodesiense. Each type has distinct characteristics and affects different regions. Gambiense is the most common form of the disease. It is found in West and Central Africa and is responsible for the majority of trypanosomiasis cases. This form of the disease progresses slowly, often taking months or even years to become fatal. Gambiense accounts for 98% of reported cases of trypanosomiasis. This high prevalence underscores the need for targeted interventions and sustained efforts to control and eventually eliminate the disease. Rhodesiense, on the other hand, is found in East and Southern Africa. This form of the disease is more acute, with symptoms appearing rapidly and progressing quickly. Without prompt treatment, it can be fatal within weeks or months. Both forms of trypanosomiasis are serious and can be fatal without treatment. Early diagnosis and treatment are crucial to managing the disease and preventing severe outcomes. Efforts to control the tsetse fly population and improve healthcare access in affected regions are essential in the fight against trypanosomiasis. The symptoms of trypanosomiasis, also known as sleeping sickness, vary significantly depending on the stage of the disease. It's crucial to recognize these symptoms early for effective treatment. The first stage is known as the hemolymphatic stage. This stage occurs when the parasites are present in the blood and lymphatic system. During this stage, the parasites are found in the blood and lymph system. Symptoms may include fever, headache, and general weakness. These symptoms can often be mistaken for other common illnesses, making early diagnosis challenging. Additional symptoms in this stage include joint pain, itching, and swollen lymph nodes. These symptoms can cause significant discomfort and may worsen over time if not addressed. A characteristic symptom of the hemolymphatic stage is a sore called a chancre that appears at the site of the tsetse fly bite. This sore can be painful and is a key indicator of the disease. The second stage of trypanosomiasis is known as the neurological stage. This stage is more severe and occurs when the parasites cross the blood-brain barrier, infecting the central nervous system. Symptoms of the neurological stage can include confusion, personality changes, and difficulty sleeping. These symptoms can severely impact a person's daily life and mental health. More severe symptoms include seizures and paralysis. These symptoms indicate significant progression of the disease and require immediate medical attention. If left untreated, the neurological stage of trypanosomiasis is often fatal. Early detection and treatment are crucial to prevent the disease from reaching this advanced stage. Recognizing the symptoms early can save lives and improve outcomes for those affected. Treatment for trypanosomiasis depends on the stage of the disease and the type of parasite involved. The disease progresses through two main stages: the early stage, where the parasite is found in the blood and lymphatic system, and the late stage, where it invades the central nervous system. Identifying the stage is crucial for determining the appropriate treatment. Several drugs are available, but some have significant side effects. These side effects can range from mild to severe, impacting the patient's overall health and quality of life. Therefore, careful consideration and monitoring are essential when administering these medications. Early-stage disease is treated with pentamidine or Suramin. Pentamidine is usually administered through an injection and is effective against Trypanosoma brucei gambiense. Suramine, on the other hand, is used for Trypanosoma brucei rhodesiense and is also given via injection. Both drugs are effective in the early stages but require careful administration. Late-stage disease, where the central nervous system is affected, is treated with melarsoprol or eflornithine. Melarsoprol is a potent drug but comes with severe side effects, including the risk of encephalopathy. Eflornithine, also known as the resurrection drug, is less toxic and has been a game-changer in treating late-stage trypanosomiasis. New drugs such as fexinidazole and acoziborole offer hope for simpler and safer treatment. These drugs are part of ongoing research and development efforts aimed at improving patient outcomes and reducing the burden of the disease. Fexinidazole is an oral drug that is effective against both stages of Trypanosoma brucei gambiense. This means it can be used to treat the disease from the early to the late stage, simplifying the treatment regimen and making it more accessible, especially in remote areas. Acoziborole is also an oral drug that is currently in clinical trials and shows promise for the treatment of both forms of the disease. If successful, it could revolutionize the way trypanosomiasis is treated, offering a more convenient and less invasive option for patients. Section 6. Preventing tsetse fly bites. Prevention of trypanosomiasis focuses on avoiding tsetse fly bites. This can be achieved through a combination of personal protection measures and vector control strategies. Personal protection includes wearing long-sleeved clothing in neutral colors, as tsetse flies are attracted to bright and dark colors. Using insect repellents containing DEET or picaridin is also effective. Avoiding areas where tsetse flies are known to be active, especially during the day, can also reduce the risk of bites. Section 7. Life after trypanosomiasis treatment. Even after successful treatment, trypanosomiasis can have long-term consequences. Some people experience neurological problems such as sleep disturbances, personality changes, and cognitive impairment. These problems can persist for months or even years after treatment. Regular medical checkups are essential after treatment to monitor for any late effects of the disease or treatment. Support groups and counseling can help individuals cope with the physical and psychological impact of the disease. Section 8. Raising awareness and support. Raising awareness about trypanosomiasis is crucial to its control and elimination. Public health campaigns can educate people about the disease, its transmission, and how to prevent it. Increased funding for research is essential to develop new and improved diagnostic tools, treatments, and control strategies. Supporting organizations working to combat trypanosomiasis can help accelerate progress towards its elimination. Section 9. Conclusion. A global health priority. Trypanosomiasis is a neglected tropical disease that affects some of the poorest and most marginalized communities in the world. It poses a significant health and economic burden on affected countries. Through increased awareness, research, and control efforts, we can strive to eliminate this debilitating disease and improve the lives of those at risk.